Now we're covering the bones for the thorax. These include all 12 pair of ribs and the sternum in the center. So here's what we're going to talk about. First, we will go through the structures of the ribs, what makes them true and false, and even typical and atypical ribs. Then we will cover the sternum, its different parts, and how it connects to the ribs. And at the end, we will put it all together with a quick look at the rib cage as a whole. What's up everyone, my name is Taim, I'm a medical doctor and I make animated medical lectures to make different topics in medicine visually easier to understand. If you would like a PDF version or a quiz of this presentation, you can find it on my website along with organized video lectures to help with your studies. Alright, let's get started. The ribs are long, curved bones that form a protective cage around the heart and lungs. We have 12 pairs in total, numbered from top to bottom, and it's easier to count them if you count from the back, where they attach to the vertebrae. Interestingly, each rib connects to the spine at the back, but not all of them connects to the sternum the same way. That's why we classify them based on how they articulate with the sternum. And because some of these ribs have the same structure and some a little bit different, we can also classify them based on structure. So 2 ways to classify ribs. Now, let's go ahead and complete the rib cage by adding the costal cartilage, which is cartilage connecting the ribs to the sternum. First, we have the true ribs. These are ribs 1 through 7. They're called true because they each connect directly to the sternum through their own individual costal cartilage. Next are the false ribs, ribs 8, 9, and 10. These don't have direct connection to the sternum. They instead share a common cartilage that merges with the cartilage of the rib above, forming an indirect link. Makes sense? What about the last 2? The last 2 ribs, ribs 11 and 12, are the floating ribs. They don't connect to the sternum at all. They end freely in the posterior abdominal wall, which gives them their name, floating ribs. So this is one way to classify ribs: true, false, and floating ribs, all based on how they articulate with the sternum. But we can also classify ribs based on their structure. Now let's look at the rib cage as a whole. And for this next part, we will take rib number 4 as an example. We will isolate it and then zoom in and go through its external and internal anatomy step by step. At the very tip of the rib, we have the costal end, also called the sternal end or Extremitas costalis. This is a flattened anterior tip of the rib where the costal cartilage would normally attach and help bridge the rib to the sternum. Posteriorly, we have the neck of the rib. This is a short, narrow portion of the bone that lies just behind the head of the rib. The head of the rib is rounded and attached to the vertebrae. How does it look like? Let's rotate the rib a little bit. Here we can see 2 articular facets. These facets connect to the vertebral bodies. One articulates with the numerically corresponding vertebrae, and the other with the vertebrae above, as you see here. Between these 2 facets, there is a small ridge called the crest, which serves as an attachment site for the intra-articular ligaments of the costovertebral joints. Joints will be covered in the next video. Next to the head on the posterior surface, we can see the tubercle. This part has 2 regions, a rough non-articular portion and a smooth oval facet called the articular facet of the tubercle, which connects with the transverse process of the corresponding thoracic vertebrae, as you see here. Then the ribs begin to bend. The point of maximum curvature is called the angle of the rib. It's clinically important because this is where the rib is the weakest and most likely to fracture. Following that, we get to the long portion called the body or shaft. It's thin, flat, and curved, forming most of the body's length. The rib has an internal surface facing the thoracic cavity and an external surface facing outwards, serving as an attachment site for thoracic muscles. On the internal surface of the body, near the inferior border, we see a shallow groove called the costal groove. This groove contains the intercostal vein, artery, and nerve, as you see here. So this is the general structures of what we call a typical rib. Most ribs, especially ribs 3 to 9, have all the structures we just went through, so we call them typical ribs. Atypical ribs, like the 1st and 2nd, also the 10th, 11th, and 12th, have some slight variations. For example, here you see the 1st and the 2nd ribs. These are both considered atypical ribs because they don't follow the same pattern as the typical ribs we just covered. The 1st rib is the shortest and broadest of all 12, and it lies mostly horizontally in the upper thorax. It has the most pronounced curve of any rib and plays a role in defining the anatomy of the root of the neck. Alright, what can we see? The first thing to notice are the muscles that attach to it. We can see the scalenus anterior muscle, which inserts onto the small bony bump on the superior surface. Just behind this is the scalenus medius muscle, which attaches to the posterior portion of the rib's upper surface. These two muscles create a space between them, and that's where we can find the subclavian artery. The subclavian vein lies anteriorly. This relationship is clinically important, especially when performing a central venous axis or evaluating thoracic outlet syndrome. Also visible here is the serratus anterior muscle, which originates on the outer surface of the ribs, just lateral to these grooves. So, what structures can we take out of this? We can see the scalenus tubercle in the center. The groove posterior to this tubercle accommodates the subclavian artery, while the groove anterior to it accommodates the subclavian vein. On the second rib, we can see the roughened area where the serratus anterior muscle attaches to, known as the tuberosity for the serratus anterior. These are important surface landmarks when identifying the first rib in dissection or imaging. Now, let's zoom out and look at the rib cage as a whole again. We've covered the first and second ribs. And next, we will go down to the remaining atypical ribs, the 10th, 11th, and 12th. What makes these three ribs atypical is that they only have one articular facet on the head. That means that they articulate with a single vertebral body, unlike the typical ribs, which articulates with two. The 10th rib usually has a single facet and otherwise resemble the typical rib, but the 11th and 12th ribs are more distinct. They don't have a neck or a tubercle, and they end freely in the posterior abdominal wall without attaching to the sternum. Remember? Floating ribs, we call them. They have a pointed anterior end and serve as an attachment point for muscles like the latissimus dorsi and quadratus lumborum. So, we got typical and atypical ribs, and this is how we generally divide the ribs in our body, anatomically at least. Next, let's do the sternum. We will isolate it and then zoom in. The sternum. This flat, elongated bone consists of three main parts. First, we have the manubrium, the broadest and the thickest part of the sternum. It serves as a point of articulation for the clavicle and the first pair of ribs. Its superior surface is concave and slopes slightly downwards as it meets the next part, the body of sternum. And inferior to the body, we find the xiphoid process, the smallest and most variable part of the sternum. It's often cartilaginous in younger individuals and ossifies with age. And it also serves as an attachment site for the diaphragm, rectus abdominis, and the transversus thoracis. Interesting thing with the xiphoid is that if you ever need to do CPR on someone, if you place your hand too low on the sternum, you can actually fracture this part, risking injury to underlying organs like the liver. But you would rather break a bone and save the life. Between the body and manubrium, we can see the sternal angle. At the superior border of the manubrium, we can see the jugular notch, which is a depression that can often be palpable at the base of the neck. Just lateral to the jugular notch are the clavicular notches, which articulates with the medial ends of the clavicle, forming the sternoclavicular joints. These are the only true joints connecting the axial skeleton to the upper limb. On each side of the manubrium, just inferior to the clavicle notches, we can see the first costal notches, which receives the costal cartilage of the first rib. These are unique because the first ribs articulates only with the manubrium, not with the body of the sternum. Inferior to this, along the lateral margins of the body, we find the remaining costal notches, which are articulation points of the costal cartilage of the ribs 2 through 7. The second costal cartilage articulates at the sternal angle, giving us a clear landmark for counting the ribs in clinical exams. Now, let's add the surrounding bones of the thorax. Here you can see the clavicle articulating at the clavicular notches, the ribs attaching via the costal cartilages into the series of the costal notches, and the xiphoid process projecting downwards at the inferior end. This orientation gives the sternum its structural role as a central anterior support for the thoracic wall. So, that was the detailed anatomy of the ribs and the sternum. Now, when you look at the thorax as a whole, at the top, we have the superior thoracic aperture, bordered by the manubrium, first rib, and the T1 vertebrae. This is a narrow opening through which the trachea, esophagus, subclavian vessels, and the brachial plexus pass between the thoracic cavity and the neck. Inferiorly, we have the inferior thoracic aperture, a wide opening formed by the xiphoid process, costal margins, and the 12 thoracic vertebrae. This opening is closed off by the diaphragm, separating the thoracic cavity from the abdominal cavity. But of course, the thoracic skeleton isn't just bones. It's held together by joints like the sternocostal and the costovertebral joints, and by connective tissue that creates a sealed and dynamic thoracic cavity. These joints and membranes allow for respiration while also protecting the organs inside. In the next video, I'm going to take you through the joints of the thoracic bones and how the ribs articulate. So click the next video and I'll see you there. If you want handmade PDF version of this lecture, take a quiz to test your knowledge, or access an organized list of all my videos, you can find everything on my website. Thanks for watching, see you in the next one.